If you've heard the placebo effect being talked about in the media or online, chances are you've heard it referred to in a negative way, which I believe is a shame. I think there are two reasons for this. The first comes from medical trials, where we're trying to establish if a treatment works. Let's say Smarty McScientist comes to me with a new compound that her lab has created called Flatulex, which she claims reduces uncomfortable and embarrassing gas. But governmental drug regulators aren't just going to take her company's word that her new treatment works, or every health influencer with a tub of white powder that they claim enhances your brain would get official clearance and be on sale in regular shops, instead of boring you with a 5-minute ad full of ridiculous promises before their scientific podcast where you should definitely trust whatever they say. No, you need to prove what you're hawking works. And this is done using a placebo. Randomized controlled trials are the cornerstone of medicine, and they show us what works and what doesn't. So Smarty McScientist needs to recruit, let's say, 100 people. She randomly allocates each person to receive either Flatulex or a placebo, which should look and apparently be identical but doesn't have any active ingredients. People often refer to placebos as sugar pills, but actually placebos can be very varied and come in different forms. As a quick aside, I know from a trial that I was involved with that placebos can be extremely expensive, which is kind of ironic. If you're testing a new use of an old medication, the actual drug might cost pennies, but the placebo can be, tens of pounds a pop. Group A in Smarty McScientist's trial gets Flatulex, and Group B gets the placebo. Neither the patients nor the doctors know who got what, which is the double-blind part. Group A report that their wind got 50% better. Well, that's a score for Smarty McScientist. She can ride that gas gravy train all the way to the windy bank. But hold on, Group B reported that their wind got 40% better. Well, the majority of Flatulex's observed effect was not actually a true effect. I'm stopping short of saying 40% was placebo because it wasn't, and I'll explain why a bit later, but it is now clear that Flatulex is far less impressive than had Smarty McScientist just given her medication to a group of people and asked if they felt better, which is often the format of TV adverts for things like beauty creams or toothpaste. 62% of women reported firmer skin, but we would have never known about Flatulex's deflated effect without a control group who are randomly assigned, so you can't pick and choose who goes into which group, and without that control group getting a placebo. So the placebo effect can be regarded as problematic or talked about in a negative way because it muddies the waters of testing new drugs.